You're listening to Puma Podcast.
Hello, ako po si Robbie Alampay, Puma Podcast, and you are listening to Teka Teka. We're pretty sure you've noticed the holiday season has brought about a spike in illnesses. Malamang you know many people who have fallen sick recently. Some face real challenges beyond the symptoms they're feeling when, for example, it becomes necessary to move between different hospitals. The problem is, most medical centers in the Philippines do not share vital patient data with one another. This can have life threatening consequences. Listen to this episode that we released in September. It talks about how solutions and technologies are already available so our hospitals can talk to each other. And if our hospitals can start sharing data, you're already on your way to getting much better, much more quickly.
Those are precious times, precious hours of preparation. Like for example, I was in a hospital in Mindanao yesterday. For a typical 2D echo, it takes them weeks, no, for the results to come out. Imagine, baka after a week, yung pasyente nag-expire na kasi masama na yung puso.
Last year, we talked to Dr. Jonas Del Rosario on another Puma podcast show, A Better Normal. Dr. Del Rosario is the spokesperson of the Philippine General Hospital. Here, he recalled an important project they embarked on during the surge brought by the Delta variant of the COVID pandemic. PGH had already allocated almost 400 beds to COVID-19 patients. Pero kulang pa rin.
We knew that still a lot of patients were not being served. Obviously, a lot of our kababayans cannot afford going to the private hospitals, no? So that's when Telegabay came in. I had this talk with the director and I said, look, we had to do something. When other hospitals are offering now teleconsultation, initially nga parang Viber call o texting through initially from our what we call, we have a PGH command center. Una, pag hindi na ma-admit, i-refer sa amin. So lahat ng hindi ma-admit ng PGH, kami yung sumasagot.
In March 2021, they launched the PGH COVID Telegabay. It was big news at the time. Sa tulong ng teknolohiya, ginabayan ng mga volunteer doctors natin ang mga naka-quarantine na pasyente habang may Delta surge.
So we eventually decided to go and use Facebook. Because Facebook, in a way, is like the social media equalizer kasi apparently Facebook pala libre to a lot. So, yun nga, parang pati yung mga medyo hirap sa buhay, nagpe-Facebook.
Through PGH COVID Telegabay, patients were guided by doctors remotely as to whether they could manage their symptoms at home or had to go to a hospital for treatment. Hindi na nila kailangang pumila sa labas ng mga ospital kung hindi naman pala kinakailangan at yung mga malala na ang sakit ay naabisuhan na magpa-confine. This was a clear example of how technology could make it easier for patients to access healthcare. But experts say progress in this regard has been slow in recent years. That's because there are problems that have been around for a while. I talked to Louie Cruz. He's been in the healthcare space for 25 years, and he's focused on the digital integration of healthcare systems. Louie is the vice chair for HL7 Philippines, the local arm of the global body pushing for interoperability in healthcare. So, how does his work play out? Think about going to the hospital for a checkup. Now, let's say that thing you're getting examined for involves the use of medical equipment. Here's Louie.
Of course, every procedure that you do on the machine, you have to input the names of the patients. So after acquiring the image that comes out has to have a name. So we usually find ways to integrate our equipments to the information system of the hospitals, which is a problem for us, no? Because there is no integration. The electronic medical record or the hospital information system cannot connect to the medical equipments. So most of the time, manual input is usually done on the equipment. But in first world countries, what they usually do is that the patient demographics are coming from the electronic medical record.
Now, in the Philippines, hospitals often use different means to collect and store data. And even across departments, kanya-kanya ng sistema. That makes it hard to integrate the data into a single system. Data integration is the process of combining data from multiple sources into a single unified view. This is important so institutions like hospitals can make informed decisions that are based on their data. But how can we integrate data if the way we do things is obsolete?
Hard copy pa rin, no? The files that you have from the hospital that you had your first checkup, then you have to bring it to the next hospital, no? Ganun yung mangyayari, no?
It goes without saying that hospitals have to collect a lot of data, from patient records to financial information. All of this can be used to improve patient care, reduce costs, and make better decisions about resource allocation. But if this data is siloed in different systems, it can be difficult to get a complete picture of how the hospital is performing. That's the crux of the matter for Louie, because there is no single standard for data integration in the Philippines, which makes it difficult for hospitals to integrate their data with other hospitals.
Whenever you say hospital information system or electronic medical records, it's either you develop your own or you buy from vendors, local vendors and international vendors. Most of the local vendors, I tell you, they create their own way of designing the information system. But it is only good for information to flow within the hospital. Billing, clinical, how to charge the patient once a service has been done.
You've probably heard this story already. Some patients get tested at the hospital, which realizes it might not be capable of dealing with that patient's illness. So they get referred to another hospital, which requires another round of tests. Isipin mo ngayon, doble gastos whenever you go from one hospital to another. That's because uulitin mo yung lab tests or x-ray whenever you switch hospitals. You might have experienced this yourself already, getting retested for something you already know you're sick with. And because hospitals don't talk, you have to spend more, and your treatment is delayed. Experts at the American nonprofit the National Academy of Medicine, better known at the time as the Institute of Medicine, actually estimated in the early 2000s that as many as 98,000 people die in any given year from preventable medical errors in hospitals. Louie says it's entirely possible that patients have died precisely because hospitals weren't able to talk, and that eventually has a toll on you, the patient.
Say for example, CT scan. Siguro CT scan, mga abdomen, siguro mga 7,000 pesos. Sabihin natin, tertiary hospital ka muna. So 7,000, skinan ka, and then urgently you have to be rushed, or maybe after a few days you have to be rushed to an apex hospital for higher level of surgery, probably laparoscopy procedure. Now you have to pay another 7,000 probably in the apex hospital, just to get another snapshot of where the cause of your pain, before before they go for open surgery or minimally invasive surgery. So that's an example of a CT scan case from a tertiary to an apex hospital, which is probably a few hundreds of kilometers probably away.
And as we know, hospital data contains sensitive patient information. It's important to ensure that this data is protected when it's integrated into a single system. That makes the idea of interoperability much more complicated. Sa ngayon, wala masyadong kakayahan ang iba't ibang computer systems natin sa medisina na mag-usap-usap at magkasundo. Kapag mayroong interoperability, madali nang ma-access at ma-share ang mga mahahalagang impormasyon tungkol sa kalusugan ng isang tao sa iba't ibang ospital, klinika o healthcare provider. Kumbaga, parang nagkakaroon tayo ng isang malawakang reference ng medical records at information na pwede nating i-check kahit saan para mas mapadali ang healthcare system natin. Imagine mo kung may pasyenteng galing sa liblib na lugar. Natural, pupunta siya sa ospital na pinakamalapit sa kanya. Doon papagawan sa kanya ng kung ano-anong tests, at kapag may resulta na, saka lang siya i-refer sa ospital na may espesyalista. Pagdating sa pangalawang hospital na kaya na siyang bigyan ng treatment na kailangan niya, kailangan niyang ulitin ang mga test na pinagawa sa kanya dati kasi nga walang interoperability. At sabi ni Louie, nakita din natin ang problemang ito noong pandemic.
The ideal approach is that the patient, it should be well communicated to the majority, to the community, that every time you feel something, you go first to the primary clinic or hospital. Remember during the COVID days, no? Everybody went to PGH. Everybody went to Vicente Soto in Cebu. Everybody went to Southern Philippines Medical Center. And pagdating mo doon, inuubo ka lang pala. It's not COVID after all. Pero in the minds of people, doon tayo. What happened? Wala namang tao sa prime. Meron tao, pero not much. Pero bugbog yung mga malalaking ospital natin, di ba? Di ba? You saw cracks, and a lot of nurses left because of that experience. Pero if we are able to navigate the patients properly, primary muna. Masa-stratify mo, mafi-filter mo rin yung patients based on their needs.
We're pausing for a quick break now. When we return, we'll tell you about how to get our hospitals talking again.
I think, patient information is very vital, Any hospital entity or healthcare entity should provide the utmost level of security for all the patient information, definitely. But that does not stop you from sharing, particularly if it is for a particular referring physician to the next hospital. There has to be some form of health information exchange. So the information can be passed on from one hospital to the other,
Again, that was Louie Cruz, the Vice Chair for HL7 Philippines. Let's imagine an ideal scenario now where hospitals do share data. In that case, a patient from a rural area could go to a primary care clinic for a routine checkup. The doctor at the primary care clinic could then access the patient's medical records from previous hospitals, including any specialist consultations or tests that have been done. This would give the doctor a more complete picture of the patient's health and allow them to provide better care.
If you're able to imagine having the medical patient's information available to all the different strata of healthcare, imagine, parating pala yung pasyente sa surgery sa tertiary hospital o sa Apex Hospital. Alam na nila kung anong gagawin, di ba? Nakita na nila yung history habang binabiyahe yung pasyente dun.
By integrating data from different systems, doctors and nurses can get a more complete view of their patient's medical history. This can help them to make better decisions about treatment and care. Louie says genuine data integration can help hospitals to identify and eliminate waste. For example, by tracking how often different tests are ordered, hospitals can identify cases where tests are being ordered unnecessarily. Interoperability with the help of IT can help hospitals to make better decisions about resource allocation. For example, by tracking how many patients are using different services, hospitals can identify areas where they need to add or reduce resources. This helps us in a pandemic too. Just imagine, a public health official could track trends in diseases and injuries across the country, and that information could be used to identify areas where interventions are needed to improve the health of the population. But to get there, individual hospitals will have to agree on one standard.
There is a way to make systems talk. There has to be a body that will police the healthcare system so everyone will adhere to some form of health information exchange. It has to be the government. Kapag sinabi ng gobyerno, mag-interoperate kayo based on this particular standard, susunod lahat yan.
Until this changes, our healthcare system will always be held back. Precious seconds and funds will be wasted on the part of patients. And this, says Louie, affects every one of us.
My final thought in this big discussion about healthcare integration is that it is workable. It is not rocket science, and we have to do it immediately. One way or another, we're gonna use that bed.
Muli, ako po si Robbie Alampay. This episode was written by Franco Luna, edited by Freddy Blanco. Our executive producer is Jill Caro, and our senior news editor is Veronica Uy. If you found this episode useful, pakishare naman sa mga kaibigan. Malaking tulong na po sa amin yan. Help Teka Teka reach more people and keep the show going. Maraming salamat po.